Doctors of Reddit, what is the biggest medical mystery you've solved? Story 1, not a huge mystery, but one that drove me nuts for 4 years. As a dentist was this guy who had severe acid erosion on all his teeth, but one area in particular was super bad. I figured he had to be obsessively eating something acidic and chewing it with one side of his mouth. I would interrogate him at every single visit, and there were tons of visits because he was totally destroying his teeth, to figure out what the hell was causing it. I probably asked the guy 50 times over 4 years if he liked to eat sour candy. Always said, not really. One day we had a long appointment together, and I just decided to name every sour candy I could think of while I worked. Captive audience. When I said crybabies, he was like, I like those, they're so sour. Come to find out he was eating 1 to 2 bags a day. Dude, what did you think I was asking about when I asked if you like to eat sour candy all of these years? Story 2, NAD. But saw this. The patient came with constant hiccuping that wouldn't go away and dizziness spells. Initially, they were told it was just hiccups and should go away, but it didn't, and it was constant. Their primary care and urgent care physicians kinda blew them off and racked it up to nothing. They wound up going to the emergency room, who did a chest x-ray to rule out some kind of weird origin. So anyways, this patient had a permanent pacemaker placed some months ago. Chest x-ray showed the wire that goes into the heart to pace them had punctured the heart, gone outside of it, and looped its way around to the other side and was sitting partially against the vagus nerve. Their constant hiccups were from their dislodged pacemaker, causing pulsations to the nerve that controls their heart rate and breathing. They wound up having the troubled lead or wire removed and replaced, and their hiccups and dizziness were fixed. Story 3, psychiatrist here. In residency, I was moonlighting at a standalone psych ER. A man who didn't speak English was brought in by emergency services for psychosis. With some interpreter help, we were able to identify he was from Bhutan and that he had been a freedom fighter, but the interpreter said that he spoke very little that was comprehensible. I noticed some tattoos that seemed amateur and possibly from his time in combat. It dawned on me he could have hepatic encephalopathy from Hep C. I arranged a transfer to a medical ER. They were pretty upset with me about it. To their credit, they called back later that night to confirm I was correct, leading to a plan of appropriate medical care instead of inappropriate psychiatric care. Story 4, diagnosed lupus cerebritis in a patient who was basically comatose after being on ECT for depression for a couple of years. I think she still had some underlying psych issues, but improved significantly after starting high-dose steroids. I was consulted as a resident on the ID service and noted the patient had persistent proteinuria and had been seen repeatedly for joint pains. My attending said we should sign off after the lumbar puncture was negative for infection, but I convinced him to let me order lupus labs before we signed off. Lupus cerebritis patient here. Multiple flares when I was 30, along with transverse myelitis. Doc finally figured it out, between episodes, when I went to an air show that summer. Feeling good when I left the house, very sick by the time I headed home. At an appointment that week, a neurologist and I were chatting. He was very interested in aviation, so I showed him a cool photo from the air show. My husband happened to have gotten my face in the photo, and there I was with a great big butterfly rash across my face. I had attributed these rashes to me being a redhead with super sensitive skin. He recognized the rash, and I had the lupus diagnosis within a week. The treatment made an immediate difference, thankfully. Story 5, I'm a medical librarian. I had a surgeon call me about a patient she was completely stumped over. He'd had a device installed, but it needed to be replaced. The problem was the location. If she tried to remove it, he would have hemorrhaged. If she'd left it in place, he would have died slowly. Did a bunch of research, even called the device maker and spoke to them. Finally found a tiny bit of a thread online, which eventually led to a YouTube video of the exact procedure she needed, and she was able to remove the device successfully. Story 6, shout out to the doctor who recognized that my toddler had leukemia. She had an ear infection with a low-grade fever that her PCP had treated with antibiotics. A week later, we took her to urgent care because she still had the fever whenever Tylenol wore off. The infection was gone, but she had been developing a lot of bruises in the weeks prior. Her PCP had dismissed the bruising when I asked if it was something to worry about. Some kids just bruise a lot, but the doctor at urgent care noticed she had bruises on her back and sent us straight to the ER for a CBC. We are 9 months into treatment and doing quite well now thanks to her. Story 7, not a doctor but a genetic counselor who works in pediatric oncology, and it's less of a What could this be? And more of a trust your gut situation. I saw an infant with a brain tumor who I was originally told had no family history of cancer, but upon talking to Mom actually had breast cancer in her 20s, and her mother had a rare sarcoma and died in her 20s. Moreover, all of their maternal relatives had cancer at young ages. Interestingly, all genetic and tumor testing for both the infant and their mom was negative thus far. Usually in that case, we say, we don't know every cause for cancer yet, and leave it at that. But the plot twist of the family history was extremely suspicious for one particular cancer predisposition syndrome, so I couldn't in good faith just end things there. I ordered a single gene test on a whole genome platform, which sequences far deeper into the gene than any other test does. Labs don't sequence that far because it's extremely rare to find anything there. In the intron, which scientists used to believe was junk DNA because introns don't get translated into protein. Sure enough, the test identified a mutation deep within the intron of this gene. It's absolutely the explanation for the child's brain tumor and his family history of cancer. Certainly a devastating result, as this cancer syndrome is associated with a 100% lifetime risk for cancer of almost any type you can think of. It's called Li-Fraumeni syndrome if you're curious. However, I'm so grateful to finally have an answer for this family, because we can ultimately pursue intensive surveillance for positive relatives that will quite literally be life-saving. And of course, this fuels my paranoia of, is a negative ever truly negative, and intensifies my desire to dig deeper for these kids. Story 8, not me, but my attending. We had an older guy with severe hip pain, but his x-ray and MRI was normal. Things were just off, and she felt like there was more going on. We got an MRI of his spine, and lo and behold, he had a huge honking spinal abscess. Most of the time, you would expect to see weakness or sensory changes with the spinal abscess. He had none of that. We imaged his whole spine and found a couple more spots of infection. So we imaged his brain, big old abscess. We also got a heart ultrasound, echo, that ended up showing a massive infection sitting on one of his heart valves. He had literally zero symptoms, except the sudden onset hip pain. Long story short, we think his bad diverticulitis let some bacteria into his blood, and he was unlucky enough to have it seed his heart valve. He ended up doing great with a truckload of antibiotics. Story 9, not the doc, but I was taking care of a patient that was hospitalized for multiple days because of crazy swings in her blood glucose. The docs couldn't figure out why 1 minute she'd be cruising well over 350 and climbing, and 20 minutes later, it would crash into the 40s. She was nothing by mouth for reasons I don't recall, possibly a gastro infection, so we were pumping IV dextrose multiple times a shift to keep her alive. We were literally down to our last vial, including robbing the crash cart on my unit and the ER, and I was freaking out because I was working alone that night. It was a rinky-dink rural outpost hospital, one doc in the ER on call, as needed for my unit overnight, no real support besides calling EMS to transport to a larger hospital over an hour away, and I was afraid of losing my patient. In between this patient's crises and other patient care, I did a deep dive on the interwebs and found a research paper that discussed how some diabetics respond that way to certain classes of antibiotics. I let the hospitalist know in the AM and provided the link to the paper, but never got a response. I was off the next night and the patient was gone when I came back for my next shift. I was afraid she died, but was informed by the outgoing shift that she was discharged home because our hospitalist figured out it was the antibiotic causing the chaos and switched meds, and immediately her blood glucose stabilized, and with the new antibiotic, the infection was brought under control. Story 10, not a doctor, but I diagnosed a coworker's epilepsy once. We worked at a restaurant and she was notorious for being insanely clumsy, in tripping or nearly falling at least 5 times a shift. I don't remember what raised my suspicions, but I asked her what she felt whenever she fell. She said it was like everything would just go white for a second and she'd lose any control of her body, but didn't think it was serious because it only lasted a second. I told her those sounded like seizures, and though I didn't know the technical name, I knew not all seizures were the big ones like you see on TV and in movies. I convinced her to at least ask her doctor about it, if only for my peace of mind. A week later, I got a huge hug and a gift basket with her, telling me I was bang on the money and according to the doctor, they just managed to catch it and start treatment before there was any permanent damage. This was years ago, but I'm still proud of that one. Story 11 had a patient who had been dismissed repeatedly as having low appetite and weight loss from depression, otherwise well with pretty unremarkable labs or vital signs, no other symptoms. Spent some time chatting with her, and she was a beloved home cook in her community. But suddenly she couldn't stand the smell or taste of the spices she normally used. Just felt off to me and ended up diagnosing adrenal insufficiency. Appetite came back within days of the proper meds. Definitely not anywhere close to the rarest thing I've diagnosed, but one of the ones I'm most proud of. Story 12, one case that mystified everyone in the hospital related to a schizophrenic man with a headache. He was there for 2 weeks telling people about the headache before he got to my mental health unit. The whole time he told everyone about how he shot himself in the head with a crossbow to remove the microchip in his brain. The first time I saw him, I was like, yeah, let's check that out. I ordered a head x-ray, which is rare because it gives little more extra information than just looking at his head, and it found a crossbow bolt embedded in his skull. Surgery was called to actually fix his headache. Story 13, I am not a doctor, but once saved my life by a simple handshake. I was in the hospital with gallstones. I was prepared for surgery, saw my surgical team, etc. All good, we are taking you up for surgery. I felt absolutely rubbish, but put it down to anxiety and the pain from the gallstones. The doctor was in the room to see the woman next to me. He was Irish, and I am Irish, both outside Ireland, so we picked up on the accent and had a little chat, as you do. As he was leaving, he went to shake my hand. He walked away and came back, questioning me that my hand was extremely sweaty. I explained that I have anxiety and it was going off, but he was not convinced. Thanks to him putting up an argument that my surgery should not go ahead and I need scans. My scan was cancelled 3 times, but he kept on pushing it through. I was diagnosed with multiple bilateral P.Es. Story 14. I was on a night shift when one of my junior colleagues called me for a puzzling patient and to come and help him out. This man would be lying down and be fine. Oxygen saturates 99% without any supplemental oxygen, and as he sat up in bed, his sats went to the high 70s, red, very bad. So the thinking was, oh, is this an infection, a pulmonary embolism, etc., etc. It had been going on for a while and no one seemed to know what it was. Reading the notes, lots of people had seen the patient and done various scans and got the lung specialists involved, but nothing was showing up. Out of pure luck, I had seen a case like this at a massive teaching hospital I'd worked at. This sign is called platypnea orthodoxia. When I first saw it, we were all puzzled, but because it was so weird and unique, it stuck. That patient had the same issue as the one I saw on this night shift, and ended up having a reasonably large hole in his heart, which was repaired, and his symptoms finished. Obviously, I immediately thought, surely this can't be that. It's a super rare diagnosis. But I kept sitting this man co's, then lying him down, and kept seeing the oxygen levels wildly fluctuate with exact correlation to his posture. So of course I thought, mate, screw it. Let's get cardiology involved. Get them to scan for a hole in the heart. PFO. Lo and behold, there was one, and it was repaired, and his symptoms went away. No one congratulated me or anything, but I was absolutely buzzing that I caught that diagnosis when no one else could. Story 15, not sure if this is a mystery, but I connected the dots as a resident, an 8-year-old kid that presented to the ER with fever, SOB, and a small lower leg wound after falling while running 2 days before. He also wasn't wanting to walk much due to pain from his leg. Everyone had assumed his wound, but when forced to ambulate, he had a bad limp. In my last year of med or PEDS residency, I presented the patient with fever from a septic hip, 2 out of 2 from his leg wound, shortness of breath and fever from pulmonary embolism also. This was my guess before labs and CT based on physical exams. In the end, I was right about everything. I was just trying to be a know-it-all, because I had a good relationship with the attending. And PE in kids is way less common than adults, so I thought I would be more obnoxious throwing in the PE part. It was humbling, because I was just being obnoxious and it made me think about what I've missed before, not turning over rocks. A similar situation years later with an elderly woman with anemia, GI bleeds and aortic stenosis that my partner ran by me. She had been scoped by GI and been to heme with negative anemia workup. Cards didn't think she warranted valve replacement. The patient kept getting passed, and my partner was getting frustrated. Being in jerk, I asked if anyone had considered Hayes syndrome. I told him put that in your note and send her back to cards. She underwent valve replacement. No more bleeding, no more anemia. Story 16, not a doctor. But I made one great call that helped my wife's quality of life tremendously. In the aftermath of her kidney transplant in the spring, she developed astonishing hyperhidrosis. She was soaking wet every day just sitting in her chair. Multiple towel changes were needed every day. White coats shrugged and disregarded the symptom. At the end of the summer, I got frustrated, did a little Google research, which suggested it was the steroid prednisone she'd been taking as part of her rejection suite of medications. So I made sure to bring it up at our next appointment. The docs agreed to change to another steroid of that class, and sure enough, her sweating went away. I, however, developed chronic smugness that still lingers. Story 17, I work in dermatology. I had a patient who was experiencing delusions of parasitosis. They literally think they have bugs crawling on their skin. It's a somewhat common psychological disease we experience in dermatology, and most of the time, it is 100% psychiatric in nature. The patient reports that he swears that he got the bugs from a partner. Physical exam on the genital area shows no abnormalities, and he has no skin abnormalities. So I ran a panel, long story short. He has neurosyphilis, and I had to send him to the hospital or infectious disease for some heavy doses of penicillin. Syphilis definitely has the reputation for being the great imitator. Story 18, I was the first to diagnose a patient with Huntington's, which is a rare neurological order that is honestly really devastating. I spotted the choleric movements, which are medical speak for involuntary dance-like movements. He presented with self-destruction, which is very common, but he is doing well now, all things considered. I've been a resident physician for less than a year, intern for context. I've got a client with Huntington's, and it's so sad seeing how it affects her, and how her life has been turned upside down since she's been showing symptoms. She has several kids and grandkids, but none of them want to get tested for the gene. Story 19, my co-resident had a very sick patient in the hospital on dialysis with persistently dangerous high levels of potassium despite dialysis, which should remove enough. The whole team couldn't figure it out. I was bored and scrolled through his orders. Turns out the man had requested 3 whole avocados a day, 1 with each meal. It's a nursing order, so the MD team is usually not notified of specific diet requests. After we stopped that, his potassium went back to normal. Story 20, I was the mystery. For most of my teens and 20s, I dealt with a nasty combination of iron deficiency anemia and copper toxicity syndrome. It means frequent lightheadedness, fainting spells, bad nosebleeds, a weird ring around my irises, strangely colored blood, to the point most people thought I was faking it when I got cut, and other symptoms. I had to get monthly, sometimes weekly blood draws if my numbers were bad, and I have tiny veins that like to roll and collapse, so that always sucked. I underwent chelation therapy multiple times, and I had these giant horse pills I had to take that made everything taste like metal for hours, but if I forgot to take one, I got woozy and loopy, and it was a bad scene. Then, I got diagnosed with thyroid cancer. They removed the tumor and my thyroid, and when they did, they discovered a mutated parathyroid. Normal people have 4 of them that look like lentils. I had 3 lentils and 1 green marble. They took the giant pea and biopsied it to rule out more cancer, and discovered it was weird inside. What was even weirder was that my first blood test after surgery had almost normal iron and copper levels that continued to level off and normalize until I no longer needed medication and my eye rings disappeared. Now I'm a case study. Story 21, this young person comes into the ER in an ambulance, passed out. They are septic, fever, hypotension, tachycardia, and they are losing 2 organ systems at the time of presentation, kidneys and liver. They can't give a history because they are obtunded. They send this person to me and, of course, don't help me with IV contrast because they don't have sufficient renal function. The images come out looking like vague gray mush, edema everywhere. I see 4 1 to 2 mm gas bubbles, 1 in the portal vein, 1 in a tributary of the superior mesenteric vein, and 2 next to the pubic symphysis. These gas bubbles do not belong there and are a grim prognosticator. I have to make some kind of wild guess because this person is close to death. I look closer and see erosions on the left pubic body. I call the surgeon and tell him to cut out the pubic symphysis, septic arthritis. I make the diagnosis in 20 minutes. They cut out the offending joint and the patient walked out of the hospital 7 days later. Follow-up CT showed hundreds of liver abscesses from bacteremia. Those cleared with continued antibiotics. My co-worker who read the follow-up CT came up to me and congratulated me on a brilliant diagnosis. Story 22, thin teen with horrible insomnia, depression, anxiety, hallucinations, nothing exciting on the physical exam. Try some sleep meds, try some SSRI, get a sleep study. She has horrible OSA, 0 risk factors, like no wonder she hates sleep. Her body knows it's not going to be getting oxygen. My pulmonologist is a very thin and fit man with none of the obvious risk factors, who has horrible OSA too. He hates that we have both stigmatized OSA, and that it's generally seen as something for obese people only. He said it causes so many medical professionals to miss it, and so many people to avoid treatment. Story 23, ER doctor. Only work at night, which means no MRI typically, no consultants unless you really need one. A patient came in at like 3 a.m. for headaches that had been going on for 5 years, with multiple different specialists working it up. Multiple imaging studies. I thought it sounded like something called cluster headaches, the management of which is just placing the patient on oxygen. Put her on oxygen and walked away. Came back like 10 minutes later, and her headache was gone. I did a Tiger Woods first pump when she said she felt 100% better. Story 24, I actually just figured one out. I've never been allergic to anything, never had eczema, no notable issues or problems skin-wise. That was until the end of December this last year. I started getting really dry patches on my eyelids that slowly got worse to fully red, swollen and flaky skin that had also spread around the edges of my face. It was so painful and I had no idea what it was. Finally got into a dermatologist and she gave me some cream because she immediately clocked it as contact dermatitis caused by an allergic reaction. The cream helped, but whenever I stopped using it, it came back, so I went in and she told me I had to do a patch test. To make a long story shorter, and my insurance messed me and I couldn't get it, so I had to get it sorted and then wait so long to get into another office just to get a patch test. Anyways, I finally got the patch test. The result was, I am incredibly allergic to nickel. Honestly, I wasn't too surprised because while I didn't think I was allergic to it, I knew I was at least sensitive, so my jewelry is nickel free. But my glasses aren't. This whole time, the reaction has been from my damn glasses and it's crazy to me. Story 25, had a big hotshot lawyer come in with some foot issues, sits all day, extremely tight posterior column, poor conditioning. It just appears his biomechanics were crap. He had a little bit of a ganglion that was imaged 2-3 years ago. The ganglion sat between the 3rd and 4th metatarsals. It didn't palpate well and irked me. Ordered imaging and the patient returned. He walked into the room on the phone and just tossed the images towards me. I turned the x-ray booth on and throw the images in. Half the forefoot and midfoot was missing and was just one huge osteosarcoma. I almost fell over in shock. He gets off the phone and he informs me he just spoke to an old client, an orthopedic surgeon. It seems with the quick string pulling and networking, the viable option is to go for the below-the-knee amputation. Again, just appeared as an occupational conditioning and biomechanical issue, but turned out to be something significantly more sinister. I felt I really did have a weird intuition to just do more investigations despite previous imaging. We ordered imaging. Story 26. Diagnosed my boss with cardiac amyloidosis after he presented to me with bilateral carpal tunnel syndrome, pseudo-seizures, and monoclonal gammopathy of unknown significance. I asked his orthopedist to send a biopsy of the tenosynovium from his planned carpal tunnel release surgery. They forgot to do it the first time. The second time, they did, and it was positive for ATTR wild-type amyloidosis. Cardiac workup showed runs of stomach and he was briefly wearing a life vest, external defibrillator. Got him seen at an amyloidosis regional center and he started on tafamidis, which at the time was a brand new drug for what was previously an untreatable condition. Story 27, local street guy presenting per EMS with medics eye rolling. worst fake seizures I've ever seen, handed off to me 1 hour after ED arrival. The prior team was frustrated. He wouldn't answer questions, couldn't get an IV or blood, insisting the patient was being difficult, uncooperative. AMS. HR sustained over 130 young men for over an hour? Moderate elevated BP, but that peripheral cyanosis had me at hello. That ain't right, and this don't make sense means it's rectal temp. Time means 108, highest possible reading. Malignant hyperthermia from recreational pharmaceuticals was later determined. Intubated, initiated rapid cooling measures. Saw the patient 3 months later, 10 degrees cooler and looking none the worse for wear.